The strength to fight. Managing childhood diarrhea.
I wash his hands, but he's always getting dirty. I tell him not to drink from the stream, but he's thirsty. And now it's been 2 days. The diarrhea won't stop. There's no blood in it, but it won't stop. He needs an antibiotic, right?
No, he doesn't.
But he needs something strong to fight the disease.
Yes, but not that.
I want him eating and playing and running around again.
Yes, exactly. He needs this. Zinc and oral rehydration solution, ORS.
Why zinc and ORS?
It stops the diarrhea and strengthens the child.
How does it work?
Most diarrhea in children is caused by a virus like rotavirus and not bacteria. Viruses are not affected by antibiotics. The body's immune system does most of the work to fight them off. These viruses cause the body to lose fluids and minerals like zinc at a high rate. Fluid loss causes dehydration, and zinc loss weakens the immune system. The immune system is how the body fights off disease. Without zinc, the body is less able to fight viruses. And remember, you also need to treat the fluid loss, and ORS has been shown to be one of the best ways to do that. Together, they help the child fight disease, get better quicker, and get his strength and appetite back.
So what do I do?
The benefits of zinc plus ORS.
Why should my child get zinc plus ORS? I've never used zinc before. Why is it so important?
This has been studied by scientists, and zinc helps the child in several ways. Zinc helps the body fight disease. Without it, the immune system doesn't work as well as it should. And if a child doesn't have enough zinc, he loses his appetite.
So zinc helps him eat better?
Yes, zinc helps the child improve his appetite and grow. To have a strong boy, you need a strong appetite, right?
Does that mean with zinc, he'll get better faster?
Yes. Zinc reduces the amount of stool that a child passes by up to 30% and shortens the number of days the diarrhea lasts by 25%. And zinc helps the child keep fighting disease. A 10-day course helps prevent future episodes of diarrhea for 2 to 3 months.
That's great. So why do I need ORS?
What's the most dangerous thing about diarrhea?
Dehydration?
Exactly. Dehydration can be life-threatening, causing convulsions, organ failure, and even death.
And ORS stops that?
Yes, ORS prevents dehydration. ORS replaces lost fluid and minerals the body needs, but it does more than that. It's got the right balance of fluid and nutrients to get the guts working again. And if you don't have that balance, you're not solving the problem.
So he can get strong again?
Yes. ORS helps the body regain strength, absorb fluid and nutrition, and stimulates appetite and activity. It shortens the duration of diarrhea better than other fluids.
Doesn't zinc do that too?
Yes, but the child needs both. They are recommended for all cases of childhood diarrhea. Zinc plus ORS work together to keep children strong and healthy. They've been proven to speed recovery, restore strength, energy and appetite, and to reduce the need for a child to go to the hospital and even save lives.
That's what I want, for my child to get strong and stay strong.
How to give zinc plus ORS.
I know zinc and ORS is the best way to treat my child's diarrhea. So how much do I give him and for how long?
Let's start with zinc. For a child younger than 6 months, give 10 milligrams. This is usually 1/2 of a 20 milligram tablet once a day for 10 days. You can easily dissolve the tablet in a small amount, about 5 milliliters of expressed breast milk, ORS, or clean water in a small spoon. In some places, zinc may also be available as a bottle of oral solution or syrup. Check the bottle for instructions. Either a small spoonful or half a spoonful is usually the dose for an infant. For a child older than 6 months, give 20 milligrams, which is usually 1 whole tablet, once a day for 10 days. You can also dissolve the tablet in clean water to make it easy to drink. If you have a bottle of oral zinc syrup, remember that the dose depends on the concentration. 1 small spoonful of syrup is usually the dose for children older than 6 months, but check the bottle for instructions. It is important that a child takes zinc for the full 10 days. Even if the diarrhea has already stopped, zinc helps the child fight disease, prevents diarrhea from coming back, and improves appetite and growth.
And how much ORS do I give?
Always follow the instructions on the ORS pack. Mix the ORS in clean, cool, not hot water. In general, give as much fluid as the child wants until the diarrhea stops.
But my child doesn't always want it. How much do I give then?
For a child younger than 2, give 1/2 cup of ORS after each loose stool, or as much as the child can drink. And for a child between the ages of 2 and 10, give 1 whole cup of ORS after each loose stool, or as much as the child can drink.
What if my child vomits? What then?
Don't worry. Just wait 10 minutes and have the child sip the ORS slowly.
And for how many days?
Keep giving ORS until the diarrhea stops. This could last several days.
And this keeps him hydrated and helps him recover sooner, correct?
Yes, you're doing just the right thing.
Childhood diarrhea. Why not antibiotics or anti-motility drugs?
My child has diarrhea. Shouldn't I give him something powerful to help him get better, like an antibiotic?
Actually, antibiotics like metronidazole and anti-motility drugs like loperamide and even kaolin mixtures, diastop, are not recommended for childhood diarrhea. In fact, these drugs can be quite dangerous for children.
Dangerous?
Yes, anti-motility drugs like loperamide, Imodium are dangerous to children for many reasons. Antidiarrheals like pepto-bismol and kelpectate are also not recommended. The body itself cleans out germs by getting rid of them. Anti-motility drugs like loperamide slow the intestines, keeping germs inside longer. That can make a child even sicker. And these drugs don't hydrate the child or kill the germs causing diarrhea. Sometimes the intestines can even be paralyzed, which is extremely dangerous. WHO and UNICEF strongly discourage the use of anti-motility drugs in infants and children. Don't use them.
But antibiotics are fine. Yes, we use them for all sorts of illness.
Yes, antibiotics have important uses in many diseases, but in most cases of childhood diarrhea, they are not recommended.
Why not?
Antibiotics kill bacteria. Most childhood diarrhea is caused by viruses or parasites. Antibiotics don't affect these types of germs at all. Antibiotics are very good treatments for many things, but in this case, they are not the right treatment. And antibiotics even cause diarrhea in some cases, as well as other side effects. Using antibiotics too often also leads to germs developing resistance, meaning that they get stronger, and then antibiotics don't work as well when they are needed.
So, when do I need them?
Children with danger signs such as blood in the stools or children who are suspected of having cholera should be taken immediately to a clinic or hospital for proper treatment. Your healthcare provider will decide the right type of antibiotic.
That makes sense. You can't just give a child any treatment. It has to be the right treatment.
Childhood diarrhea. The danger signs.
I don't think my child is getting better like he should. How do I know when to go to a health center?
There are 6 signs to look for. If you see any of these signs, it's time to get help and get to a health center. Number 1. If there is blood in the stool. Number 2. If the child is having convulsions. Number 3. If the child is vomiting everything and can't keep anything down. Number 4. If the child is not able to breastfeed or drink. Number 5. If the child is very sleepy or unconscious. And number 6. If there is no improvement after taking Zinc plus ORS.
Thank you. Now I know what to do and when to get help.
I'll check on you both in a couple of days to see how you're doing.
Hello, doctor. He's doing much better. Thank you.
I can see that.
And I knew what to look for, so I didn't panic.
That's excellent.
Zinc plus ORS. Zinc plus ORS is a powerful and proven treatment for childhood diarrhea.
Together, they help the child fight disease, get better quicker, and get his strength and appetite back.
Zinc plus ORS are recommended for all cases of childhood diarrhea.
It's important that the child takes zinc for the full 10 days, even if the diarrhea has already stopped. Zinc helps fight disease, prevents diarrhea from coming back, and improves appetite and growth.
And keep giving ORS until diarrhea stops. This could last several days.
Remember that in most cases of childhood diarrhea, antibiotics are not recommended, and anti-motility drugs are never appropriate for children.
Together, we can give children the strength to fight diarrhea.
And give mothers the confidence that they are doing the right thing for their children.